everyone, welcome to GrowMed. Welcome back, and today's session is about the images, and we will be discussing the important images asked in the exam. Okay, and I'll also tell you कि कौन सा image किस exam में पूछा गया था. So we'll also discuss a few things related to the images. So see, look at the first image. This image, you can see that this disease is called as the sporothrix, and this is also called as rose gardener's disease because mostly associated with the people who work in the gardens and all, due to pricking of some kind of flower or a thorn. Okay, that one, a thorn. And the things related to this which you must remember is, as you can see here, these lesions are like following a single pathway, and these are subcutaneous lesions, and these involve the lymphatics of the part. So lymphatic pattern they follow, like along the lymphatics they occur. Okay, and the organism, it is the dimorphic fungi which causes this disease, dimorphic fungi known as Sporothrix shanghai. And on a HPE, like if you take the lesion and do the pathology, on pathology you can find the cigar body. So these are few important things which you must remember, and if all these things are described in a clinical case, then and if image is given, then it will be very easier to come to the answer that it is the sporothrix. Okay, so this is about the sporothrix. The question was asked in the June 23 exam. It is asked multiple time in the NEET PG as well. Okay, then moving on to the next. This question was asked in the NEET. I exactly don't remember which year. I think NEET 22 this question was asked. So from the anatomy, and you can see here the question asked, like they had given a defect here, a defect, and they had asked this defect occurs from which, due to defect in which pharyngeal arch. So the pharyngeal arch 6. So yes, due to the defect in the pharyngeal arch 6, this defect will be occurring, the patent ductus arteriosus, because it will not close. Usually it should close, and if it does not close, then this kind of defect can be seen. Okay, then moving on to the next image. A very famous image asked in integration with the biochem, asked in integration with the ophthalmology, and sometimes can be asked in the pediatric also, because this is mostly associated with these children, pediatric age group mein dikhta hai. And biochemistry, just because it is associated with the storage diseases associated with this glycogen. Okay, and ophthalmology because it's involving the eyes. So it is the galactosemia, seen in galactosemia, and this is a cataract called as an oil drop cataract. So this image based question was asked, I think in the recent exam only it was asked in the Fmge, and this galactosemia case is frequently asked from the biochemistry, like in almost all the exams. According to my recalls, it was asked in the June 23 I guess. Then along with that, in the December 22 was also this galactosemia question was asked. So the, if a clinical case is described, no, things will be described like the child is not able to eat and hypoglycemia can be seen. Then this oil drop cataract one is there, and I think vomiting भी उसमें दिया जाता है कभी कभार question में. ठीक है, so these all are the things which you must look for. Then moving on to the next, from the image from the orthopedics. So you can see here this image, this is a image from the bone tumor, and you can see here this one. So seen, this pattern is seen with the bone osteosarcoma, and this particular appearance is called as the sunburst appearance. Okay, so whenever these sunburn pattern or appearance, whenever these things are given in the clinical case also, you must be having an idea that the examiner is asking about the osteosarcoma. The ophthalmology may orthopedic, maybe this is an important one, and from the radiological point of view also, because these x-rays and these image based question are usually asked in integration with the radiology. Then moving on to the next topic, see image from the obs and gynec, and this is a hysterosalpingography. So as you can see here that HSG tube is being inserted, and dye is uh, injected into the uterus. So this kind of particular appearance, as where you can see here that there is a filling defect in above the at the top part of the uterus, and this is mostly associated with the septate uterus. So they will just give this image and they will ask what is the abnormality detected in the image. So it is the septate uterus. Okay. So there are various HSG images. Like if you want a video, I will do the video on this HSG hysterosalpingography, this because from this we can come to know about the Asherman syndrome. This Asherman syndrome question was also asked in the past years. Then we can come to know about this uh, unicornuate uterus, bicornuate uterus. Then we can also come to know about the fallopian tubes, with either they are patent or they are not patent. So these are the important things related to this HSG, and sometimes the images were also asked on this instrument used in the HSG. Okay, so have a idea of that also. Then moving on to the next image, a very important image and a very important disease. So this comes from the surgery, ecclesia cardia, and according to the analysis, if you go and check into the past papers, ecclesia cardia question is always repeated in the exam. So I think in this exam also a question might come on this. So note down all the things and have an idea of this ecclesia cardia. Okay, so see here, this is the barium swallow given in the esophagus, and the condition associated with the ecclesia cardia is the absent relaxation at the lower esophageal sphincter. So this lower esophageal sphincter jo hai, wahan par because of the absent relaxation, the food starts getting accumulated here only, and the esophagus starts to dilate. Okay, so this is the main physiology behind this ecclesia cardia. So then the next image, this is an image from the forensic medicine. I think this same image was asked in the NEET PG exam, and it was asked what kind of wounds these are. So these are the defense wounds, because as you can see they are present at the part which is like exposed, and usually such kind of wounds happen when a person is trying to defend himself from any attack. Okay, so while defending himself, he will get these kind of wounds. So this is about this defense wounds. Just remember this one. So yes, we have discussed some important images. If you like this session and if you want to continue such kind of sessions, so comment down, and these sessions will usually help you to brush up your mind in the peak time, as you'll be like fed up of studying and revising the whole things. So just in the break times, watch this 5 to 10 minutes video to brush up your memory. And what if like कोई भी question आ जाए इसमें से, तो it will be helpful to you only. ठीक है, तो I will be discussing most of those things which are like repeat and which are very important, which have a chance of coming in the exam. So do watch these videos once, twice, and make a note of these things. And for the PDF, you can join my Telegram channel, as there are many other PDFs also available for free in my Telegram channel. On the Instagram, you can follow me. I'll be sharing the important flashcards. And yes, that's it. Thank you so much for watching the video. All the best for the exam. I am Dr. Padmini, your mentor for the FMG. Thank you so much, guys. All the best.